Hi, my name is Rick Rawson, and I'm the president of Adventist Health and Rideout. I am really excited today to introduce something that is going to make a transformative difference in our community. We here at Rideout have spent the last 3 years improving the quality of medical care that this community has, and we have a lot to be very proud of. But our mission of living God's love by inspiring health, wholeness, and hope calls us to so much more. That more transcends just the provision of care and asks a bigger question. How are these communities better places to live because we're here? What difference can we make beyond just caring for those that are sick to be relevant in the lives of everybody who lives in the community we call home? It is my honor to introduce Nick Buettner, who will share with us what the Blue Zones has to offer to our communities. Nick has spent 20 years traveling the world, learning the principles of what makes the most difference in longevity, on well-being, and happiness. He has a passion for improving communities, for teaching what they have learned in their travels around the world to really what we can do to make transformative impact in the communities we have the opportunity to serve. So it's my pleasure to introduce to you Nick Buettner, who will walk us through what the Blue Zones is, what difference it can make, and how we can all become engaged in transforming the quality of life in our communities.
Hi, my name is Nick Buettner. I'm the Vice President of Engagement for Blue Zone Project. We all know we have a healthcare crisis here in America. If current trends continue, over 70% are going to be overweight, over 50% are going to be obese. For the first time in history, the life expectancy for kids is less of that of our own. And the reason why isn't because we're bad parents. It's because we've designed communities that make it hard for us to move, that aren't pro-social. We're not coming together as an engaged community base. We don't understand our purpose and have opportunities to be able to live it out. And our food system doesn't create equity for all around the healthy eating. The mission of Blue Zone Project, our calling, is try to empower everyone everywhere to live a longer, happier life. Just to break that down, to try to empower, to co-create opportunities and tools and processes and cultures and environments where everyone everywhere, no matter what your socioeconomic status, no matter the type of organization or the community you live in, you can live a longer, happier, more purposeful life. This work has come from the research my brother Dan and I have done to places around the world where people are living the longest life, where they have the lowest rates of middle-age mortality, places where they're reaching 100 at rates 10 times higher than they're doing it here in America. And I think more importantly, they're doing it with a fraction of the disease, because it is about our quality of life, not just our quantity. Now, our goal was to partner with epidemiologists, with researchers, with physicians, with demographers, to go to these communities, demographically prove them that they are the longest place in the world, but more importantly, to see if we could reverse engineer a recipe for longevity. What we're able to do is to find the 9 commonalities, these 9 lifestyle traits that flew through all the different regions we traveled. We call them the Power 9, and these are simple traits when integrated into your life can help you live longer, be healthier, and in some ways even be happier. And these are simple things that we do, such as in the Blue Zone communities, they move naturally. Their jobs were set up for them to move naturally throughout the days. They weren't running marathons, they weren't doing triathlons. Instead, their life was set up for them to move naturally. They had a strong sense of purpose in their life that they could articulate, whether they were 20 or 100. And people who can articulate their sense of purpose actually live 7.5 years longer. They had these simple techniques to help reduce stress. Stress in our life that causes inflammation that is correlated to most age-related diseases. And in some cases, they're as simple as just being able to laugh. They lived off a healthier diet, a plant-based diet. They weren't vegans or vegetarians, but it was mostly plant-based, with fruits and vegetables that they grew in their own gardens. But along with those healthy foods, they also had the skills. They also had the knowledge of what was good for you, and they ate healthier caloric intakes that created strong bodies, late into life. We know from the Framingham research that isolation kills. 25 years ago, the average American had 3 best friends. That's now down to a friend and a half. And if you have less than 3 friends, you're defined as lonely. And the impact that that has on your body is about the same as smoking a pack of cigarettes a day. In these communities, what they were able to do is cultivate relationships, cultivate friendships at a young age that then lasted all the way through their lifetime, that supported each other when they're having a bad day. And they also had the support of family. As you age, you're always surrounded by love. Now, my brother Dan wrote up these stories for National Geographic, one of the top-selling National Geographics in history. But in 2009, when we wanted to bring these lessons to America, the first thing we thought about is, hey, your community is not going to be Okinawa. Your community is not going to be Loma Linda. So how do we set up communities where that model the Blue Zone behaviors, that model the behaviors that we learned from those Blue Zone communities? And at the heart of it was this. Never once in our trip did we ever meet somebody at age 50 who said, I want to go on a Blue Zone diet so I can make it to 100. Never once did I meet somebody at age 50 who said, you know what, I want to start exercising so I can make it to 100. Longevity was never something they pursued. Rather, it ensued because of their environment. So what Blue Zone tried to do is we try to look at the life radius. Most of what you do is within side of a 20 miles of where you work and where you live. And if you can optimize that environment to make the healthy choice, ideally the unavoidable choice, if not the easy choice, then longevity doesn't have to be pursued. Rather, it will just happen in our communities. And what we focus on is our policies in our community, the places where we spend our time, as well as our individual engagement. How are we setting our communities up so it's easier for us to be able to walk and move naturally, to be able to bike in our communities, where the designs are set up where we're not afraid to allow our kids to walk to the park, to bike to school because of the design of our streets. Communities where placemaking, where people are able to come together around healthier behaviors. We look at policies tied to our food environment, of access and availability to healthier foods. Our affordability, is it cheap? Can everybody afford it? Or do the underserved communities have a harder time affording those healthier foods? And can you look at that food distribution to ensure that everybody has that access, and that access is brought to us in a way with the food skills so that we know what to do with it when we get those healthier foods? We also try to look at policy around addiction like smoking. How do we set up environments that make it harder for our kids to start smoking and easier for us to stop smoking once we start? We work with places where we work, live, play, and pray, to look at our grocery stores and the design of our grocery stores to create better access and, again, affordability to healthier foods inside of those spaces, including in our checkout lanes. To be able to look at our restaurants, not to change the way that people are doing business in those restaurants right now, but to be able to set up a choice architecture where people that want to be healthier can not only order the foods or get healthier sides, but it's a lower caloric intake as well. So we're eating those healthier portions tied to the Power 9. We want to look at the work sites in our communities where most people are spending most of their waking hours during the week. Look at those environments both outside of the organization and inside, like our cafeterias, like our vending machines. But it's not only around food and exercise. We also want to make sure that the purpose of the individual is aligned to the purpose of the organization, so that the individual feels like they're part of something bigger than just themselves. But at the same time, if me as an organization understand the purpose of my employees, I can better develop that employee to make sure that they're more productive and they're liking what they're doing and they'll stay with that job for a while. Along with that 3 best friends that I mentioned earlier, according to Gallup, number one thing that indicates whether or not you want to go to work is whether or not you have a good friend. Nobody wants to go to work with somebody that they hate, so how do we also go in and set up environments where it's pro-social? cross-departmental in those organizations. We also want to work with schools that set up environments where it's easy for kids, like I mentioned earlier, to walk or bike to school. Schools where we can build our friendships outside of schools with our peers. And we can look at environments inside of the classroom and how we're behaving around mindfulness inside of those classrooms, as well as our cafeterias, in a way that creates peer-to-peer learning, that create those habits, and those well-being habits that kids want all the way through their life, or that we want our kids to have all the way through their life. And do it in a way where you're supported with your friends. And it's not just around healthy eating. It's also around healthy movement, those behaviors, as well as mindfulness. How do we create healthier processes when we have stress? So that as kids, they can release that stress before their tests and before their exams or before they want to start bullying that kid sitting next to them. Through all of our place-based work, it's not about us telling those organizations what to do, but we have menus with over 600 choices. We have a team on the ground that will actually work with those organizations, but they get to choose what they want to do inside of their organization. And if they do enough things, we'll actually designate them. We'll actually approve them as an organization in that community. And we will celebrate them to ideally drive more business, drive more economic value to those places. So policy, places, and the last one is at an individual level. We will work at an individual level to help people design their homes, to make that healthy choice easier, to look at how they're spending more time with their family around healthier activities, to break down that isolation in communities, to programs that actually create more supportive friendship, that are helping you out when you have a bad day, as well as programs that help us identify the purpose of our life, the reason we want to get up in the morning, and ideally be able to then live it out every single day, like creating connections to volunteerism, to create a more engaged community where everybody is coming together around health and well-being in that community. So it's a whole community supporting their neighbors. And again, this in all the areas, whether it's the individual level, organization level, or the policy level, this isn't me, this isn't Blue Zone coming to your community saying this is what you have to do, but instead we bring a framework and processes that allow you, that allows the individuals and the leaders in the community to set up an environment, to set up the environment that meets your culture and an environment that meets you where you're at. Because I'm guarantee you're already doing some great things, but how do we then support those great things and help you overcome those challenges by creating a plan, a blueprint for that transformation, which will roll out over the next 3 to 5 years, depending on the size of your community. Blue Zones is about more than just wellness. The definition of Blue Zones, what we focus on, is well-being. Health is a state of complete physical, mental, and social well-being. It's not just the absence of disease. And we bring in tools. We bring in the well-being index to oversample the community even before we get to the blueprint. What we want to do is oversample the community with that tool that was developed in partnership with Gallup to understand at an individual level, do the community members living in your community have a sense of purpose that they could articulate? There's questions that look at the social health of those individuals, our financial well-being, not how much money they make, but how secure do they feel in that? How does the community and the place that they live impact their health? And lastly, the physical health. And what we know from our partnership with Gallup is that if we can tweak any one of those areas, they actually have huge impact on health. They have mental health impacts, they have community impacts, they have organization impacts, as well as just health outcomes on an individual and on a community base. So what Blue Zones does is we'll come to your community with a journey, a 3 to 5 year journey with the goal of at the end to see if we can get enough of your individuals, organizations, and leadership engaged in Blue Zones, aware and actually engaged, to see if we can improve the key community self-reported metrics. Before we do our blueprint, we will work with you, the community, to determine what are those outcomes that you want to see tied to Blue Zones. Put them in the blueprint, make sure we have strategies, but we'll also link those to other reduction in population health and those risk factors as measured by the well-being index. And lastly, to make sure that we're impacting outcomes and evidence change in the deployment of our work in our organization at an individual level, as well as making sure those policies have impact. So that we're actually creating the value back to the community to create a healthier community that you live in. Now, we've deployed this in a lot of states, and we've seen impact. We know from the Well-Being Index, one community between 2010 and 2017, they saw obesity rates drop, they saw fruits and vegetables uptake. This is the beach cities in southern Florida, or Southern California, and what they saw was stress rate drop. Now, this is a community that had the same stress rates as Sierra Leone or inner city Detroit. And they also saw a generational impact. They were doing great work before we arrived in 2010. But between 2010 and 2017, what they ended up seeing is a 68% reduction in childhood obesity. And this is sustained improvement. Now, what does that mean for a community 20 years down the road when those kids are healthier, or those kids have those tools and healthier behaviors that will last a lifetime for them? Now, the Surgeon General came to town, looked at our work, and said, in an age when poor health seems so intractable, you've been able to take a community from a place of resignation to a place of hope. That's our goal, to bring that hope. Now, Blue Zones has been around since 2009. And what we've seen is impact in all the 61 communities that we work in. We've impacted over 4 million individuals in America's life. This is a proven model. It's a model that works, whether it's a smaller rural community like Albert Lea, Minnesota, population about 15,000, that saw impact on their tourist rates, that saw impact on their county health rankings. And they also saw $40 million worth of add-on grants that helped support other initiatives that the community is doing. It brought more funding to the community. Whether it's a mid-sized community like the beach cities, we talked earlier about the impact on childhood obesity, but they also saw the life evaluation. The people that were living in that community, 12% higher rates. They wanted to live there. They loved their community more. And communities like Fort Worth, Texas, over 1 million people, already 900,000 lives. Very diverse socioeconomically, a lot of vulnerable populations who actually saw the biggest impact, and we saw impact across the board. Impact in just the tobacco alone saved that county over billions of dollars for years to come. And it even has impact at an organizational level. And one work site that we worked with in southern Florida, a hospital system, they saw $27 million worth of reduced self-insured claims costs. And I think what's so important about this is, as measured by Gallup, not measured by me, these changes are sustainable. These changes actually last well after Blue Zone leaves those communities. We create that framework, help you create that tipping point. Now, we've done a bunch of research, and one of the things that we've learned that we now know is what are some of the challenges around community health initiatives. Well, for starters, what you need is a strong coalition of leadership, a leadership that has that same vision around health and well-being. You have to put the right resources, both economic and human resources, into these. This is not for the light of heart. Health actually costs money. They actually have to put resources into it in order to move the needle. But you also have to make sure that you're leveraging sustainable expertise, that expertise that a lot of your community has, but Blue Zones can come in and power them up with our national experts to be able to support them in the work they're doing, help them lift it up and give them more support that they need to be able to drive the outcomes that they want. And last thing, you need tools and you need community accountability to the plan, to the blueprint. And you have to be able to measure them with key performance indicators so that you know you're moving the needle. And what Blue Zones tries to focus on, what we try to do is understand the value. The value promise of Blue Zones, what we hope to be able to bring to your community, at a work site and at an individual level, is more purpose, at an organization and an individual level. People understand their purpose and are able to live it out. To be able to deepen consumer engagement, because an engaged community around well-being is a healthier community. To be able to come back and enhance your community brand equity. If you look at the articles that just came out on Deloitte, articles from the Surgeon General, what they do is they talk about how well-being and communities that are defined as well-being in places where people want to move their kids, where they want to raise their kids, has that value and that equity in our community. Improve health and well-being to lower the health-related costs of disease and that quality of life that impacts, to improve individual and organizational outcomes and performance. People that are healthier perform better. They attract better, healthier places to the organization, and they cost that organization less. And then we also want to make sure that we're vitalizing that regional economy, that through the partnerships coming together and that collaboration actually creates more resiliency and better support for our communities. Now, the success of Blue Zones isn't based on us. These are community-powered. We need leaders like yourself to come forward, to be at the table around this common vision, around health, with other leaders, with other organizations and other individuals, so that we can all come together to define the community that you want, the community that focuses on health and well-being. Thank you.